And we have Dr. Urvi Shah. Welcome, Dr. Urvi Shah, who's our guest speaker today. Thank you very much for accepting our invite and coming here to talk to us on the importance of nutrition in cancer. In India, as we all know, the cancer risk is increasing. I mean, there is the more incidence of cancer, and it is estimated that the incidence of cancer will go up by about 12 to 13% in the next 4 to 5 years. And about 1 in 9 people are likely to develop cancer in their lifetime. So it's a huge disease burden. And it's very important to prioritize our health by working on the modifiable risk factors, by adopting a healthy lifestyle, focusing on our nutrition and all the other pillars of lifestyle medicine. And we have just the right person today to talk to us about the importance of the role of nutrition in cancer prevention, treatment, and overall survivorship. So just a brief introduction of Dr. Urvi. Dr. Urvi is an assistant attending in the Myeloma Service at Memorial Sloan Kettering Cancer Center and an assistant professor of medicine at the Weill Cornell Medicine Center in New York. She's board certified in internal medicine, hematology, and medical oncology, and received a Master of Science degree in clinical and translational cancer research. Her research interests include modifiable risk factors like diet, metabolism, microbiome in cancer. She completed her first pilot nutrition trial in plasma cell disorders, that is the Nutrivention trial, and also has 3 other dietary trials enrolling. Congratulations on that. That's a very big achievement. Dr. Shah has also been supported by several career development awards, including National Cancer Institute, International Myeloma Society, and American Society of Hematology, and several research awards as well. She has published several papers in prominent journals and has been an invited speaker and chair in national and international conferences and seminars and webinars. So welcome once again, Dr. Urvi. Over to you.
Thank you so much for the invitation, Dr. Amrita. I also see that there is a thing saying remaining meeting time 11 minutes. Do you know if this?
Yes. No, I think Shruti has sorted that out, she said. So.
Okay, I guess if it disconnects, we'll just log back in. Is that how it works?
Yes.
Or should we? Hello.
Yeah.
Bhavani?
I see now it says it's on.
Yeah. So yeah,
please
I think
go ahead with it.
That's sorted, yeah.
Great. So it's great to speak to you all, and I'm happy to chat about questions after. But I think that this is a very unmet need for patients and also doctors, as there's a lot of unanswered questions and things we need to think about. These are my disclosures. So what food or supplements should I take? This is a very common question, most likely asked question by our patients, and also the least likely answered by oncologists or even doctors. And I think that's why lifestyle research and infrastructure is very much needed. Patients want it, and it can empower them. It's low cost, and it can improve outcomes, whether directly or indirectly. And so part of my focus has been to study this and build the evidence that would help bring these infrastructure and understand why it's important to do it. One important concept or why nutrition needs are so important and why it's such an issue these days is people who are surveyed, and this is of course in the US. I think India might be a bit different, but not too much. I think now with the changing food trends, but they asked people, do you get enough fiber in your diet? And 67% said, yeah, I think I do. But in reality, only 5% did. So actually there's a big disconnect in what we think we do versus what we actually do. And this is a significant fiber deficiency of like very few people actually achieving that. And fiber is really key to having a healthy microbiome, healthy gut lining, and then healthy immune system too. So I just wanted to show you patient perspective on why this is important. So a patient once reached out to me and on social media and sent me this message. My very respectable oncologist team answered, just keep eating a balanced diet. And I think so many of us doctors fall into that trap of saying, yes, eat a balanced diet. But many times patients don't really understand what that means. And I don't know often, even if oncologists or doctors sometimes understand what exactly that means. And so these are oncologists on social media commenting, saying, we should just tell patients eat a well-balanced diet. And maybe these fruit and vegetable recommendations is a lot for cancer patients, and we shouldn't be telling them this of 2.5 servings. Vegetables and 1.5 servings of fruit. So that got me thinking when I saw these very opposite comments is what is a balanced diet and who follows this? And I think when you look at the guidance from the USDA, so these are the recommended for the US population, is fruit 1.5 to 2 servings, vegetable 2 to 3 servings, and fiber about 25 to 35. We talked about this, but very, very few people are actually eating enough of this. You can see just 10% of people meet the vegetable requirements, less than 5% the fiber. And when you look at cancer patients, this study looked at it, only 12%, similar to the general population, meet these requirements, and only 4% adhere to all lifestyle guidelines, suggesting there is a lot of room and scope for improvement. When we ask patients also with plasma cell disorders, so plasma cell disorders, if you're not familiar, include multiple myeloma, the blood cancer, and the precursor states of MGUS or monoclonal gammopathy and smoldering myeloma. So we asked them, since your diagnosis, did you have questions? Almost all did. We asked them if the oncologist addressed it. Most said the oncologist did not. And if they got recommendations, many attempted to follow them. Patients also make changes on their own, whether we tell them or not, after a serious diagnosis like cancer. So you can see here that there was a significant increase in consumption of healthier food and a decrease in consumption of unhealthy food in these patients. I don't know if you all are aware of these guidelines, but these are from the World Cancer Research Fund and the American Institute of Cancer Research. But you can see that 10 out of 10 of these guidelines, 6 are related to food and suggest eating a diet rich in whole grains, vegetables, fruits, and beans, and also limiting fast food, red and processed meats, sugary drinks, alcohol, and supplements are not going to help to prevent cancer. Foods that fight cancer include, if you look at this, they have a whole section on their website, but it's really all plant foods. And then foods to limit, there is red processed meat, alcohol, sugary drinks. The American Institute of Cancer Research and other also large cancer research bodies believe that about at least a third or at least 20% to a third of cancers could be prevented if people had normal BMI, ate a healthy diet, and worked out regularly. So that's a huge area for prevention and ability as primary care doctors or general practitioners to influence or reduce risk for patients. When we think about pre-diagnosis dietary patterns, you can see here, these are 3 studies from 3 countries. All the countries showed that people who ate more plants had less cancer by 15 to 20%, irrespective of the way they analyzed it. So some grouped people into vegans, vegetarians, meat eaters. Another study grouped it into a dietary score. So those who got a higher score means they were eating more plants, and then they had less cancer. So I think you're seeing a common theme here in these big, large population studies too. When we think about mechanisms or how does diet affect cancer and risk, so we published this paper a few years ago. We looked at how a plant-based diet through fiber reduces the time of the food in the intestine. So it's less mutagens which interact with the colon. You have the phytochemicals or flavonoids. You have the short-chain fatty acids made by the microbiome. And then you have improvements in weight, insulin resistance, IGF-1, and inflammation. So really multiple mechanisms. Many people now are like focused on low carb diets and ketogenic diets, and I see that trend even increasing in India, unfortunately. And so just think about when we talk about a ketogenic diet, yes, when somebody is low carb, they might see an improvement in insulin or weight or inflammation. To achieve the ketogenic diet, they need to also be in ketosis and have these ketone bodies like beta hydroxybutyrate. The ketone bodies have anti-cancer, anti-inflammatory effects similar to butyrate. So maybe that's the way. But the issue with the ketogenic diet is when people become so low carb, they focus mainly on animal meat and protein. And so they don't get enough fiber, they don't get the flavonoid, they don't get the short chain fatty acids. So all of that is not there. Also, even if all of those things were not there, the other issue is that many people think they're on a ketogenic diet, but in truth, they're on a low carb diet and they don't get this benefit. The only benefits they're getting are maybe weight and inflammation. We should all be reducing refined carbohydrates and fried foods. So that's when someone goes on a ketogenic, they prioritize avoiding those foods, which I think is why they feel better. But even on a healthy plant-based diet, those things should be avoided. And very few people really achieve ketosis to actually have the effect of the ketone body because it's a very hard diet to sustain with almost no carbs. And that's why when we looked at the number of trials ongoing, you can see that most of the trials are actually for ketogenic diet terminated because it's hard to accrue patients, it's hard to keep patients, or they're unknown status. And when we look at plant-based diet trials, first of all, there are very few being done because ketogenic, or it's a novel diet or something different. And the plant-based diet trials, none of them are really terminated. I think patients are able to do it and complete the trials. Another dietary pattern that's looked at is fasting or intermittent fasting, fasting mimicking diets, calorie restriction, and those work through, again, reducing IGF-1, maybe increasing ketone bodies that have the anti-cancer, anti-inflammatory effects. And so I think it's important, if we think about this, it's just basically the importance of meal timings and giving the gut some time of rest during the day. Obesity is a very clear link or association with cancer, especially for these 13 cancers. And amongst them, multiple myeloma, which is the blood cancer, is also one of them. And so I think that's part of why I've been interested in focusing on it. And we think that there are multiple mechanisms through which obesity drives cancer. Of course, it's the hormones, inflammation, insulin resistance, and just the actual fat cells that interact with the cancer cells. Another metabolic disorder, and in India, we're seeing a lot of this, right? Diabetes, obesity, but the diabetes also, when you think about it, it's a risk factor for cancer, having diabetes, especially uncontrolled or poorly controlled. But you can see that diabetes and cancer, there is a correlation. And you could say that, oh, the same factors like the poor diet that causes cancer causes diabetes too. But you could also say that it's a causation where the poor diet and the other reasons that they may have diabetes, and then the high sugar, high insulin drive the cancer growth. And this study shows you a little bit of why that maybe there is partly a causation effect. So in this study, what they did is they looked at type 1 diabetics and they looked at their dose of insulin. And so is there an association with cancer development? And they showed that people who were on higher dose of insulin actually had more likelihood of developing cancer compared to those on the lower dose, suggesting that insulin dose, because insulin is a hormone that can drive cell growth, is associated with increased cancer risk and suggests that the diabetes is not as well controlled. We looked at just analyzed patients with myeloma and looked at like if they have diabetes, what's their survival, and if they don't. And you can see that diabetics have much worse survival than non-diabetics with cancer. And diabetes is also more prevalent in certain populations, I think Indian as well, but of course here we don't have a high number to study that. But when we look at Black population too, it's double than the white population, suggesting that there is more opportunity or room for improvement. And then we looked at a mouse model of diabetes and myeloma, and we showed that in the mice that have the myeloma with the diabetes, the cancer progresses much faster than in the mice that just have the myeloma without the diabetes. And then the next concept I want to talk about is microbiome. So we are more microbiome than human cells. And so I think it's important when you talk to patients too, that they understand the importance of feeding the microbiome and not just feeding ourselves what we like to eat, the processed foods or other things. The microbiome really needs fiber to thrive, and you can see that the microbiome is central to health and disease in many different aspects. And microbiome diversity, so this is a concept of like understanding, think of a rainforest versus a plantation of the same species of like a tree, like maybe a banana plantation. So the diversity in a rainforest is different species of birds, animals, plants, all of that, and that makes it a healthy ecosystem. When we have only one type of plant, it's not as healthy as an ecosystem. So I think that that's important to think about, and you can see that high diversity is associated with better survival. So when there's a more variety in the microbiome of different bacteria, there is better diversity compared to low diversity with less survival. Foods that affect the immune system. So we have this study looking at healthy individuals, and you can see that a high fiber diet was associated with improved microbiome function, such like more short chain fatty acids, which I will talk more about later, and also changes in the immune response. And more fermented foods were associated with also diversity and decreased inflammation in the body. In this study, they looked at diet and its effect on the immune system. And you can see what they did is they had patients eat about 2 weeks of a vegan diet or 2 weeks of a keto diet, and then they switched the groups. One important thing to note is that both the groups lost weight, right? You can see a reduction here. But in the ketogenic, which is the low carb or the red line, they lost more fat-free mass. When we think about fat-free mass, that is muscle and water, which is not a good thing, especially in cancer patients. So the ketogenic diet lost more muscle, whereas the low fat, which is the vegan diet, lost more fat. So I think that's also important. It's not just about losing weight, what kind of weight, and ketogenic diets maybe lead to muscle loss because they are high fat diets, so it's not the fat that's being lost. What you can see here too is that there's changes in the immune system with changes in different immune cells with these diets, suggesting that we can enhance the immune system too with dietary changes. And maybe the ketogenic diet had a little more changes in the adaptive immune system, and the vegan diet had even the adaptive, but more in the innate immune system, so natural killer cells and other populations that you see an increase as well. When we think about, infection, so if you're saying immune systems affected by diet, then you can look at COVID as one example of infection risk based on dietary pattern. There are multiple studies. I'm just going to show you one, but this study shows that people who, like these were healthcare workers in 6 countries, and the healthcare workers who were eating more of a plant-based diet had 73% lower odds of moderate to severe COVID, and those on low-carb diets actually had a higher risk of COVID, suggesting again that there is an anti-inflammatory effect and an immune modulating effect of diet. So now that we've gone through like how diet and how metabolic disorders affect cancer risk through obesity, diabetes, the microbiome, immune system, I'll go through trials in the prevention space, treatment space, and then survivorship space. And then we'll talk about some practical tips, and then we can answer questions. So when we think about the prevention space, like if patients have pre-cancer states, we have an opportunity as hematologists, oncologists to prevent or reduce risk for cancer development. But also as general practitioners, if you see a patient with pre-cancer or you see patients even without cancer, but they will be at risk for cancer, how to reduce risk. We know that when these cancers progress, there's more genetic changes, more mutations, and also more immune system dysfunction. We know that these modifiable factors affect the immune system, like I showed you already. And these disorders are very widely prevalent in the US, but also in India now. And as we have more of these abnormalities in metabolism, diet, the microbiome, there's probably a higher risk for myeloma development. And we've seen this in many different studies. Some of them are cited down here. And can we tilt the scale and reduce myeloma risk with changing diet? So we know in myeloma, and I showed you already in the general population, but in myeloma too, there are these studies, patients who were participants eating more of vegan vegetarian dietary patterns had a 77% lower odds of developing myeloma. And then we published this study showing a 17% lower odds if they were eating more plant-based foods, so a higher score. And then we also published this showing that, the pre-cancer state MGUS, which is basically an abnormal protein in the blood, some of these patients can go on to develop cancer. So when they have this thing, it's concerning for them and they worry because now they have this pre-cancer state. We looked at the pre-cancer state and said, what dietary patterns are associated with developing this pre-cancer state. And we showed that soft drinks and sugary drinks increase the risk by 40 to 60%, and fruits, vegetables, whole grains lower the risk by 30 to 60% too. You can see here that the same MGUS state, if the people had a normal weight, their risk was for progression was lower than if they had an elevated weight. So the risk, when you look at the hazard ratio of 2, that means there's double the risk of progression for somebody who's obese compared to someone who has a normal weight to progress to cancer from the pre-cancer state. And you're seeing the same thing in another study, a hazard ratio of 2, meaning double the risk of progression. So what this suggests too is that elevated weight increases risk to progress to myeloma. So can we reduce risk by helping patients lose weight, improving diet, as we saw all of these association studies? So that was the Nutrivention trial, basically taking patients with this pre-cancer states with a BMI over 25. 20 of these patients were enrolled, and we provided them with 3 months of high-fiber plant-based foods, 6 months of coaching. We followed them for a year. We basically shipped them food from a company. You can see examples of what we shipped them. We said, you don't need to calorie restrict. You eat till you're full, like satiety, but as long as you eat unprocessed plant foods for all your meals, at least, and we were trying to guide them to do that. We were looking mainly to see, is this feasible? Do they lose weight? And then are we able to see any signal for anything else? What we saw was there was a 7% weight loss. This is week 12, so this is baseline, week 12, week 24, and 1 year. And you can see that the weight loss was sustained even 1 year out. We also saw improvement in dietary adherence. So patients were increased from 20% to 92% on unprocessed plant food, the calories of their intake. And this was also high at 1 year, much better than where they started at least. Fiber intake improved. The healthy eating index, it's a score of a higher, better dietary pattern. So we increased their score, and that also remained high a year out. Suggesting that we were truly able to improve diet quality for these patients by guiding them and initially providing meals for some time. We also improved their quality of life. So we measured it with surveying the patients, and you can see that one of the measures called global health status, meaning overall quality of life, improved. Patients actually, surprisingly, amongst the 15 that responded, nobody said it was difficult, and they all said it was easy or very easy. And then we had a post-intervention survey asking them, did you feel better in any domains of your life? And you can see that the green bars tell you how many felt this improved. And it was things like weight, cholesterol, self-confidence, depression, anxiety, joint pain, GI symptoms. And 4 participants also reported being able to stop medications because they didn't need them anymore. Like insulin, one was able to stop, an antidepressant, potassium. This is a medication for autoimmune diseases. And so they were able to save quite a bit of money too by stopping these prescriptions monthly. The next question is, did this have any effect on the cancer? And so in myeloma and MGUS and smoldering, we are able to follow a blood protein called the M spike. And this protein over time, it kind of correlates with disease burden. So as the protein increases, we know that the cancer or the precancer is progressing. And you can see these 2 gray lines. These were 2 patients whose, before the intervention, it was progressing slowly. On the intervention, it slowed down. So the trajectory of progression slowed down, suggesting that maybe the intervention could delay progression to cancer. The other patients had stable disease or low-level disease, so it was hard to see a change, but at least for these 2 patients, we did. And some of the mechanisms of how this could be is through insulin resistance. So we saw insulin levels come down. So remember, these people are eating plant foods, so complex carbohydrates. There's no reduction in carb intake, but their insulin levels went down because they removed refined carbohydrates. Complex carbohydrates are part of a healthy diet and do not need to be taken out. You can see that the insulin resistance, this is another measure of insulin resistance, so a higher level is better. This improved. Cholesterol dropped by 20 points. So it's possible to help with like high cholesterol too. And then you may say, like, what kind of weight did they lose? Did they lose muscle or fat? You're making them eat a plant-based diet. Are they getting enough protein? So could it be that they're losing muscle because maybe they're not getting enough protein? There's a lot of influencers and in misinformation out there that you need to eat animal protein to get enough protein all the time. And so you can see here that these are 6 patients on the study, and we looked at body composition by CT scans, and you can see that these patients to the right of this red line lost more than 5% weight on the study, and these 3 lost less than 5% weight. So if you focus on the 3 that lost more than 5% weight, that's a significant weight loss. You can see that there's no change in muscle for these 2 patients, and this patient actually gained muscle but did not lose muscle, and gained muscle by almost 10% of volume of muscle and lost almost 10% weight. Suggesting that it is possible to gain muscle too, and that none of the patients really lost muscle. Another important thing is looking at diversity. So I told you diversity, higher diversity, better gut health. We show that this improved. We also show butyrate producers. So these are bacteria that make these short chain fatty acids like butyrate that have anti-cancer, anti-inflammatory effects. We want more of these. And we see that this also had a trend towards increasing. The function of the bacteria changed. So these are enzymes made by the bacteria. And you can see that the carbohydrate active enzymes, which can basically digest fiber, also changed and increased. And then we see that higher BMI is associated with lower diversity. So that's one thing. And we saw more fiber, more diversity, another thing. So there's an association. Then we looked at inflammation and anti-tumor immunity, and you can see that there's a reduction in inflammation. So the C-reactive protein levels dropped by half in the 7 people who it was elevated in. And then even the absolute neutrophil count, it went down as well. When we look at flow cytometry, there was a change in immune cells too. So we see a reduction in the classical non-classical, so inflammatory monocytes, and an increase in the anti-inflammatory monocytes. So these are different types of white cells, and we're seeing basically a shift in the white cells to a more anti-inflammatory pattern. We see less inflammation of cytokines too. And then we did bone marrow analysis of the immune cells. So this has never really been done in a dietary study before because most dietary studies can't get bone marrow samples. But since these are blood cancer or pre-cancer patients, we had bone marrow samples. And you can see again, there's an immune shift, even in the bone marrow, similar to the blood, where there's more of the anti-inflammatory monocytes, and a change in the signaling or the pathways of inflammation as well, suggesting a shift in the function of these cells too. This plot is basically showing you the interaction between different cells. What you see in blue are all the myeloid cells. So different types of myeloid cells, monocytes, myeloid-derived suppressor cells, granulocyte, monocyte, progenitor cells. All the gray lines are showing you how the interaction of these cells were before the intervention or before the study. And if you look closely, all these myeloid cells, the gray line is thickest towards the CD8 exhausted cells, suggesting that these myeloid cells are interacting mainly with exhausted cells before the study. And then when you look at the green lines, those are basically the interactions after the study. And you can see that the shift is mainly to interaction with more of the cytotoxic or the anti-tumor cells and the natural killer cells too, which have anti-tumor effects. And we see the same thing in specific pathways like tumor necrosis factor, exhausted shifted to cytotoxic, and the natural killer dim. We looked at this in mice too, and the mice got a high fiber diet versus a standard diet. And you can see that the mice that got a high fiber diet, half of them never progressed from the smoldering myeloma to the cancer, whereas all the mice in the standard diet progressed at the end of the experiment. And you see similar microbiome and immune changes to what you see in the blood and in the human trial. This was one of the patients on the study with permission. This was before the study. This was after. So he was able to also stop insulin for some time and come off it after a month on the study. And we're doing other studies looking at how in smoldering myeloma patients, if we can do a short intervention and see if that can affect the microbiome in a short period. Studies suggest it could, but we're looking at different supplements too. And then this is a much bigger study of 150 patients, very similar to the study I just showed you, the pilot that is ongoing, and hopefully in a few years we'll have some results to show, looking at diet and supplements on these pre-cancer patients. Next, now we talked about the prevention space, thinking about treatment. So when patients are on treatments, can diet improve response to treatments? I'm going to show you some results in a few different cancers, and then we can see. So in melanoma, patients on immune checkpoint inhibitors, so these are immune therapies, those who ate enough fiber actually had a much longer progression-free survival than those who didn't get enough fiber. And you can also see the same thing here, that those who ate more of a plant-forward fiber-rich diet, a Mediterranean kind, had a better response and better survival too. In this study, many times, when patients are going through transplant, doctors will tell them, oh, you cannot eat fresh fruits and vegetables and you need to only eat cooked foods. And that is very restrictive sometimes to the patient. So this study basically compared a protective diet, meaning this restrictive diet of saying you can only eat cooked foods and thick peel fruits versus an unrestricted diet where you, as long as you're eating general hygiene standards and you don't eat things that have a high risk of infection, maybe street foods or things like that, is it possible to not have more infections? And they showed that both groups had no difference in infections, but the group that was on the protective diet actually lost more weight because they were not able to eat enough, and their quality of life was also worse. So it's important to allow fresh fruits and vegetables, but make sure that they're washed properly and cleaned as well. So maybe eating them at home instead of outside. This study looked at a specific bacteria, and it was a probiotic. Now, I'm not recommending that every patient take a probiotic because every bacteria is different and we need to study them better to understand. But in this study, they actually showed that this specific probiotic, when patients took it with a checkpoint inhibitor for melanoma, kidney cancer, there was an improvement in survival compared to those who just took the drug without that probiotic. And this suggests that it is possible that the microbiome is modulating the immune system and responses to the treatment. A fasting mimicking diet is something called where they give 5 days of for fasting, like a very low calorie diet for 600 to 300 calories, and then the rest of the month patients can eat whatever they want. I think that the fasting has maybe some effects on, of course, insulin, IGF-1. We would expect that, similar to what I've shown you before, but even short-term periods of eating healthier and maybe low calories can improve all of these things. They also showed that it affected and improved the immune system in some ways by changing immune changes. But I think that this is still too early to recommend to patients because this is just one study and we have to still look at outcomes. And it can be very restrictive for somebody who is on cancer treatment to eat only 300 calories in a day. So I would not recommend it. I've showed you that we can have these effects by eating really healthy fiber-rich foods as well. This was a breast cancer study with patients with stage 1 to 3 breast cancer, and they randomized them to get usual care, meaning their standard just chemotherapy, or they got exercise and a plant-based diet intervention. And they showed they were looking at changes in dose intensity or differences, which they didn't see. But what was interesting is in a subgroup of patients who were receiving neoadjuvant, meaning the chemotherapy before their surgery, they showed that the likelihood of being in a complete response to the chemotherapy was 53% in the intervention group versus 28% in the control group, suggesting it was double. By just changing diet and lifestyle while getting chemotherapy, they were more likely to be in a complete response. And then this study in leukemia again shows the same thing, that patients who, for 1 month, they made them eat healthier, exercise, and showed that there was a higher response rate compared to a control group, which was from another study. So they are now doing a proper randomized study, and that study is ongoing, but it suggests to us that diet may affect response too. And then lastly, if we think about interventions to improve survival, is it possible that after patients have finished cancer treatment and they're survivors, that this could help too? And you can see here that this is colon cancer. And patients who followed these American Cancer Society guidelines had, when you see a hazard ratio less than 1 with a p-value that's significant, it suggests a reduced risk for death when it's overall survival. So patients who followed this guidelines of a healthy lifestyle were actually almost 40% or 30-40% more likely to live longer and have less likelihood of the cancer coming back. We showed this in myeloma, where patients who were on maintenance therapy, if they had better microbiome health and measured by diversity, butyrate producers and butyrate concentration, they were more likely to be in complete remission to or sustained MRD negative. And they were also more likely to be associated with eating healthier foods and foods that had flavonoids, that is, plant chemicals. And so we think that diet may affect myeloma control through the microbiome and immune system. And we are doing a study by giving patients a diet and to understand that. And so I think that starting to think about how diet, physical activity, and some of these things can affect the microbiome, the metabolism, immune system, and outcomes. And I think more research in this area is currently ongoing. And lastly, just a few practical tips to consider. I think based on all the evidence currently, I would recommend that we're reducing refined carbohydrates and sugary foods, fried foods, but whole grains, which are basically things like brown rice, quinoa, buckwheat, millets in India, those are associated with reduced cancer risk. I didn't show you that data. So whole grains are an important part of a healthy diet and should be included. And not the refined grains, so not the maida or the white flour, but the whole flour. And fiber, and they come with fiber, they come with vitamins, minerals, fruits, vegetables, diversity of plant foods. So more types of plant foods eaten, like more than 30 types a week, are also associated with better microbiome health. Eating plant proteins is important. So a lot of dals, legumes, beans are important. Fermented foods are good. And there's so many varieties of fermented foods that are available. And then unsaturated fats are more important than saturated fats. And I think that many people focus on calorie counting. That can be very hard to sustain long term. And it's really not necessary if a person really switches their diet to eating healthy, unprocessed plant foods, because that just leads to less calories automatically. And frozen fruits and vegetables are also equally healthy. So if somebody doesn't have access or time to go every day and buy fresh fruits and vegetables, they can buy the frozen bags as well. And it's important to now, sometimes look at labels too and understand sometimes what is added sugar. There's a lot of added sugar to things where they might say, oh, very like a whole grain or healthy, but then when you look at or high protein, but when you look at the ingredients, the added sugar is very high. And that can sometimes be, so 4 grams or 3.5 grams of added sugar is equal to 1 teaspoon. So we want to keep the teaspoons of sugar at least less than 6 to 9. Many people assume that eating healthy is boring because they have to eat salads every day. I don't think that's true. They can eat pretty much everything that they like. It just needs to be thought about. So making a burger healthy or a pizza healthier version, or thinking about chickpeas or oats for breakfast or things like that. But it can all be done with a healthier version. And then lastly, I find that a lot of people have questions about where does fiber come from and where does protein come from. So this is just an example to give you some understanding of that. if people are moving towards a Western diet, a processed food diet, you can see many times if they eat something like this, they're not going to get enough fiber because animal foods have zero fiber. And so the only fiber they will get is from things like the broccoli that they ate or some vegetables on the side. If they're eating a high fiber diet with like beans and fruits and vegetables, they will get plenty of fiber, more than enough, and that's important. I think the minimum is at least 30 grams. So if somebody gets more, that's not a bad thing. And then when you look at protein, many people say like, oh, if they're eating plant foods, they're not going to get enough protein. But remember, even oatmeal has protein, peanut butter has protein, broccoli has protein. Like every food has protein, fats, and carbohydrates. It's just the proportion. And if you're getting enough calories, you will get enough protein. So if somebody is 60 kilos, and they need to get about 48 grams of protein. Suppose you say that they need more protein because they are older or they have cancer or something else, then they need 72 grams. But even this high fiber diet is getting enough protein. And so I think that it's important to understand that protein is possible with eating healthy foods. A cup of black beans has about 15 grams of protein, or any beans actually have 15 grams. And I think many people assume that they have to be fully vegan or fully vegetarian. What I'm trying to explain is that like a vegan diet can be very healthy because I'm talking about high fiber plant-based foods, but sometimes people will do a vegan diet more for just for the ethical reasons, which are very important too, but they may end up eating French fries and fried foods or chips and things like that. So it's not healthy anymore. And then vegetarian, many people who are vegetarian eat a lot of cheese and dairy and eggs and processed foods. So if they're doing that, the amount of plant foods they're eating is still very low. So even though they're vegetarian, they're mainly animal based in their calories that they're getting. So what I'm talking about is basically the majority of calories coming from fiber-rich plant foods. And whichever way somebody does it, it needs to be the majority of calories, like at least half the plate fruits and vegetables, quarter whole grains, and a quarter mostly protein, but mostly plant protein. And so I sometimes tell patients, pick a goal from this, trying to think about it. And then my last slide is just thinking about, with climate change and all of these things, we wrote an article a few years ago on the connection between diet and climate change. And there is a whole forum called the Eat Lancet Forum that's published a very detailed article on this too. But if you think about a diet that's healthy for the planet and also healthy for people, the good news is it's actually very tightly linked, what's good for people and the planet. So I just want to show you greenhouse gas emissions. If you think about different foods, and this is one serving, and you can see that eating meat has about 1,200 grams of greenhouse gas emission per serving of meat. Whereas eating one serving of beans has less than one. So it's 1 to 1,200 in terms of the effect of greenhouse gas emissions on the planet by just changing our diet. And this study looked at and analyzed totally, like if people move towards eating plant-rich diets, we would basically cut greenhouse gas emissions by almost half. If we just ate healthy diets with healthy calories without processed foods, but didn't fully go to plant-based diets, we would still see an improvement in greenhouse gas emissions, suggesting that it's something that as we as medical professionals have the opportunity to influence patients, family members, the population, we're also indirectly influencing the planet. And I think that what you're seeing is that diet can affect outcomes both for the patient and the planet. And this is the Eat Lancet plate for a healthy diet. And you can see it very much matches what we've talked about so far too. And so with that, I'd just like to conclude. I think it's important to think about a high fiber diet has many mechanisms through weight, insulin resistance, gut microbiome, short chain fatty acids, inflammation, immune system, cancer cells, maybe inhibition. And we've published some of these reviews looking at details on mechanisms. With that, I'd really like to thank my colleagues, mentors, patients who took part in these studies, and co-authors on all of this research, as well as the funding agencies without which it would not be possible to do it. So thank you for listening, and happy to take questions.
Thank you, Dr. Urvi, for a very insightful presentation, very informative. And thank you for sharing your expertise, your knowledge. You're actually doing the study, so you're very much into it. And it was really nice hearing all the things you said about how we can modify certain risk factors and how a diet plays such an important role in all sorts of cancers. Also, thank you for all the practical tips that you gave us. There are a few questions. Just so what kind of diet should be prescribed in an elderly patient with Parkinson's and sarcopenia?
So that's a good question. I'm not specifically researching that, but I will say you can look up the work of Dean Ornish, and he published a trial for patients with, so this is not Parkinson's, it's for dementia, but older individuals, and he showed how there is possibility of, with changing the diet again to a plant-based diet and exercise and lifestyle changes, that he was able to reverse or slow down dementia for patients as well. And that was recently got some news or press for patients. So I think elderly patients, one is also, it's important to understand, is the patient eating or not? If they're not eating anything or they're not getting enough calories, then maybe it's important we just get them to eat things and we pick more calorie dense foods. So things like, even if they are healthy plant foods, nuts and seeds are very calorie dense, which is good if you need someone to maintain weight or gain weight or things like that. Beans are also another good source of protein, fiber, and everything. So trying to increase that consumption. If they're not eating enough, like smoothies or things can also help to increase calories, because when we drink calories, we end up having more than if we try to chew them or eat them. So those are some ways to improve calorie intake, or even fruits. If somebody didn't want to, eat fruits, fresh fruits, maybe make a smoothie with it, with greens as well. And you can easily get a whole serving of greens in a smoothie without having to eat a salad or something. So if people are not willing to make those changes, those are ways that it could be done. I see a question about B12 deficiency. And so to address that, I think it's important to understand, where does B12 come from for us as individuals. And the majority of B12 is not, we don't make B12 really, but we get the B12 from microbes in the soil usually. So if we ate dirt, we would get B12 because the microbes in the soil make the B12. However, now that we live in a world where everything's washed and cleaned, we're of course not going to eat soil or dirt, so we're not getting enough B12. When we eat animals or meat, we get B12 because the animals in animal agriculture are often injected with B12, or they are eating the dirt or the soil because they're eating the grass from the soil, and so the meat has some B12 in it. If somebody switches to a fully plant-based diet and getting no animal-based products, then I think it's important maybe once a week to just take a B12 supplement, which can be a low dose, 500 micrograms, but it just needs to be once a week to basically get that B12. I have also seen enough people who eat Western diets or omnivorous diets and be B12 deficient. So I think it is basically because of just the processed food nature and things like that, where we're not getting enough microbes for the B12 with that. So in general, I think that that's really where it is. And I think that's why it's not truly a deficiency of plant-based diets, but it's a deficiency of our food system or the way we have moved towards in terms of eating more like clean foods, which I think we should because we don't want pathogens and everything, but that's where it's coming from. And then I see there's a question about during the immediate post-transplant period, was that related to the Neutro diet trial and looking at how they ate fresh fruits and vegetables? So that was in the post-transplant and peri-transplant period and showed those outcomes. So I think it's important, but in India, sometimes food poisoning or GI infections may be a slightly higher risk compared to probably the country in which that study was done. So I think it's important that even if patients decide to eat fresh fruits and vegetables, they're not eating it outside probably, but you guide them to maybe wash them really thoroughly at home and then eat them. But I think that that would be okay if it is truly cleaned well. And then there's a question about colon cancer patient undergoing chemotherapy. Actually, colon cancer is one of the cancers that are more clearly linked to the association maybe with diet in terms of fiber. Fiber is very important to reduce colon cancer risk, dietary fiber, sugary drinks or things like that, because the colon mucosal lining directly interacts with the food we eat. And there's also a thought that if people are not getting enough fiber, they're not having regular bowel movements. If they are very constipated for many days or things like that, then the food that stays in contact with the mucosa and doesn't pass through, so it can over time lead to more interactions and risk of cancer development. There is a study looking at red and processed meat and colon cancer, and that I didn't show it, but it shows that higher intake of red and processed meat through different mutational signatures might be increasing the incidence of colon cancer. They actually show mechanism of how red and processed meat is linked to colon cancer in that study. And so I think for GI cancers especially, there is this link that with processed meat, and the IARC, so the International Agency on Research for Cancer, in 2015 published an article in Lancet called red and processed, like for red and processed meat intake and basically its association with cancer. There was clear evidence for a few GI cancers, pancreatic, colorectal, things like that. So I think even for colon cancer patients undergoing chemotherapy, they don't want you want better responses, and you want patients to not have a cancer come back. So I think it's a high fiber plant-rich diet is really going to be likely the best for outcomes. Of course, we don't have a study that's exactly looked at an interventional study that's done that. And ideally, a study like that should be done.
Yeah. I mean, WHO has also, the processed meat is grade 1 carcinogens, isn't it? It's treated as grade 1 carcinogenic. So, yeah. Also, what foods will increase butyrate levels? Any particular foods that you would recommend to increase the butyrate levels?
So there are two things. One is that some people look up and they say like, oh, butter increases butyrate. But the butter, like you have to eat a lot of butter to get a little bit of butyrate production. And that has enough of negative health benefits. So it is not a way to increase butyrate. When the microbiome gets a high fiber rich, plant rich diet, it makes it increases the butyrate producing bacteria. And the job of these bacteria is to make butyrate and other short chain fatty acids. So you could see, which I went through a bit fast, but in the mouse models, the mice increased these short chain fatty acid producing bacteria after getting a high fiber diet, and the butyrate levels also increased. The acetate, propionate, other short chain fatty acids also increased. And they increase first in the colon, and then they kind of migrate into the bloodstream and then help with the immune function. So butyrate is associated with anti-cancer effects, anti-inflammatory effects, but just eating regularly fiber-rich diet, our microbiome will make that butyrate, and then you will have those effects. But it's important to do that.
And do you give your patients omega-3 and curcumin supplements or tablets?
So in smoldering myeloma and MGUS, there have been some research showing that curcumin may be associated with better outcomes, but it was a study that was done only looking at clinical outcomes, and it was maybe some long-term patients on it. So it's not clear fully from those studies that does it really help. It's more like case reports and case series. So in our study, we are actually giving, studying curcumin and omega-3 combination for the patients on the Nutrivention 3 study. So I feel at this point, I don't have the data to say that it's definitely necessary because it's expensive and things like that too. But it may be, but that's what we will see for that specific cancer. I think in general, I would not recommend that every person takes a curcumin supplement or an omega-3. Curcumin, I think that there are some studies that show it helps with arthritis and joint pain and things like that. So if somebody has that and they want to try it, not a problem. Only couple things is, one is if you're taking curcumin, the purified curcumin, like curcumin C3 complex, then these are very high doses, and it might be important to check liver function because there are case reports sometimes of liver failure or elevations in liver enzymes. So if somebody already has fatty liver or liver problems with slight even liver function issues, I would say we need to be much more cautious and adjust the dose. And then, in general, these drugs also have interactions. So if somebody's on many medications, then I would be careful because if they're already on 20 other drugs, there could be drug interactions, and these curcumin can inhibit different enzymes or things like that.
I mean, in
And
our
then,
Indian diet, we do use turmeric quite
exactly.
some
So that's
dals, all the vegetable curries.
exactly.
So I'm hoping that's providing us some protection.
Exactly. So I think that's these herbs and spices are very important and good that we use a lot in Indian cooking. And lastly, you talked about omega-3. So I think omega-3 fatty acids have associated health benefits. Plant sources of omega-3 can include things like chia seeds, flax seeds, walnuts, things like that. So just increasing those foods can also be a way to get some omega-3s. It's not fully clear, meaning there's no study to say for sure that like everybody should take an omega-3 supplement. We are looking at an algae-based omega-3 supplement instead of fish-based. And I think that's because even fish, when they get omega-3, they're getting it from algae. They are eating the algae, and then that's why it's there in the fish. But so we go straight to the source. You get also flaxseed omega-3 supplements or things like that, which basically go straight to the source of the omega-3 instead of through fish, which are kind of the middlemen for it. And it also depends on how the fish are raised, because if they are raised in an animal agriculture kind of way, then they are not eating the seaweed or the wild algae, and they may not even have that much omega-3. So that's the challenge also of modern day fishing and things where not all seafood has the same amount of omega-3 even.
Absolutely. I think we don't have any more questions. So thank you again, Dr. Urvi, for your time, your efforts, and for engaging with our audience and answering all our questions. It was a very informative talk, and there are quite a few takeaways from today's session. And I'm hoping that it's benefited a lot of us here, and it will benefit our patients as well. So thank you very much. Have a good day.
You too. Thank you so much.
Good night, everybody.
Bye.
Thank you. Bye-bye. Bye.